Hello everyone, I'm Dr. Hamza Al-Ashwa. Welcome again. We have today a new study. We have spine examination in the playlist of MRCS Part P examination, our frame. So we have our frame as we said before. After you enter the room, you have to ask, you have firstly wash your hands and introduce yourself, confirm patient details, explain the examinations and gain the consent, and also ask for the exposure and offer the chaperone and ask about the pain. This is what related to ortho through lock, feel, move, special test. In lock, we have after this, after doing the three, we have finally to thank the patient again, to thank the patient and wash the hand. By more details, after wash your hand, after you introduce from the room, wash your hands and introduce yourself. Good afternoon, my name is Dr. blah blah blah. My name is Dr. Hamza. I'm one of the surgical doctors. May I confirm your name and age, please? And explain the examinations. Today, I have been asked to examine your back. Is that okay with you to get the consent? And the examination, including the exposure of your trunk and may expose the leg. The examiner with you as a chaperone. And before you start, ask about pain. Do you feel any pain at the moment, which is important, okay? After that, we transform to the first one of the main item or the main scope of the examinations, which is lock, okay? Firstly, walking. Could you please take a few steps for me? Normal. Could you please take a few steps in the tip of toes? Could you please take a few steps over your heel? Could you please take a few steps, one foot in front of one? Okay. After that, you have to inspect from the front for the head and neck exposure, for the symmetry of the shoulders, and also inspect from the side while the patient stands, okay? For the cervical lordosis or thoracic kyphosis or lumbar lordosis, inspect from behind for scars, muscle wasting, scoliosis, abnormal hair growth, and also doing the romping test in this by this flow. To don't after the patient lie on the couch and ask again to stand up. So take this flow to be smooth more and save your time, okay? After that, we go for the feeling, okay? Palpate, spinal process, firstly temperature and tenderness, okay? Spinous process, sacroiliac joint, and spinal muscles. Albeit for ligament regularity and tenderness, okay? After that, we have to go for the movements. Well, the patient is standing also, cervical extension, cervical flexion, cervical rotational, cervical lateral flexion, lumbar flexion, lumbar lateral flexion, lumbar extension, thoracic rotation. Can you take these movements from GK Medics to be imagine about this movements, okay? After that, we transform for special tests. We have to do Schober's test, a straight leg test, which is important, femoral nerve stretch. If you find a time with you, you have to do top cards. Check the tone, leg tone by 3 tests, okay? Leg roll, leg lift, ankle clonus, and also the power for hip and the ankle. Hip flexion, extension, also knee flexion, extension, okay? Ankle dorsiflexion, plantar flexion, big toe extension, ankle inversion, ankle eversion, okay? And also coordinations by heel to knee, chin test. Also joint proprioception, up, downs, okay? Also reflexes, knee reflex, L3, L4, ankle S1, L5, and also check the vibrations and check the sensations, light and pin perk, the crude sensations or okay. After that, we thank the patient. Thanks that you let me examine you and wash your hands and go to discuss your case with the examiner. This is how to get the flow while you are in the room of the examinations of a spine case. You have to go through the 6 minutes by this way. You have to save your time by this way. I promise you. If you find this is helpful for you, please give me our advices to improve or likes, comments, as you like. Give me your impression, which is important for me. Okay. Thanks for your listening.